Welcome. My name is David Lewis Peart. I'm the Youth Services Analyst with the Ontario Association of Children's Aid Societies here at the house in Toronto. We are partners with StepStones for Youth on the peer-to-peer knowledge exchange, which is an initiative that was initiated during the COVID-19 pandemic from its founder, Shua Ruskies, some time ago. We're grateful to have you all on this call, and I'll be turning it over shortly to my colleagues from StepStones.
Everyone, so happy to have you all join us. As David mentioned, the peer-to-peer knowledge exchange was founded in part by Shua Roskies. And in her memory here at StepStones, we wanted to announce a new fund in memory of a dedicated advocate for children and youth in the foster care system and the founder of the peer-to-peer knowledge exchange. And as many folks on this call know from personal experience with Shua, she worked tirelessly to ensure that no young person fell through the cracks. And this new funding initiative at StepStones that we're calling the Shua Roskies Youth Homelessness Prevention Fund was developed in collaboration with Shua's colleagues and loved ones. And it will provide essential support for housing stabilization and basic needs for young people from care, including rental assistance and emergency funds, through our online housing grant portal, which was co-designed by Shua when she worked with us. We hope this initiative continues her legacy of empowering and protecting our community's most vulnerable youth. And I will put the link in the chat so you can learn more about the Shua Roskies Homelessness Prevention Fund and how to support us, and just how to get involved with StepStones as well. So yes, I want to hand it over to Mr. Erwin Elman, who is a community partner of part of the work that we're going to hear about today. So yes, I'll hand it over to Erwin to say a few words and to introduce our speakers today.
Thank you, Poma. Well, I'm going to introduce Pippa Rollcliffe, sorry. I just want to say the report, Don't Look Away, just a really tiny connection I had to that report. Oh my God, Jennifer's here too. I just saw that. Now I'm really nervous. I did not realize Jennifer, the representative for children and youth in BC, was going to be here, and now, like, oh my God, I gotta hide that sign behind me with the fist in the roast. No, like there. All right. Welcome, Jennifer.
Yeah.
I want to say that just to have a small part in this report, Don't Look Away, unbelievable honor. Like, it is such a courageous report. That's a systemic review, and better than I think maybe not my staff, but I certainly could have done, and done with kindness and intellect, and as I said, courage. So yes, and I was always, and I'm so grateful to StepStones to try and bring the spirit of that report and information in that report to Ontario, because as people would know, I really think we need it. So let me say, I'm assuming I don't have my screen, but Pippa's there. So I'm going to introduce both Pippa and Jennifer, and what I would say is that they have long, not dating them, but they have long histories working with children and youth in all sorts of ways, unparalleled. And they became the deputy director, deputy representative, and the representative for BC children and youth. And I was thinking about what to say about Pippa, so let me say this. We have the kite and the string. This is I don't know if I told you this, Jennifer, but that's how I think about it. Jennifer they're both so intelligent. They both have enormous hearts. Jennifer certainly wears it on her sleeve. Committed to children. And the way I experience them is that Jennifer is, I might be wrong, but Jennifer is this dynamic kite that is thinking and going, where can I support change? How can I listen to kids? And Pippa is her string to the kite, because we all know that a kite alone is not very functional, and string alone is not very functional. And they are this incredible dynamic duo. And to have both of them together, that's a real privilege and an honor, because they've made enormous gains and are an enormous support to children and youth in British Columbia. And we're honored. I'm sitting in Ontario. And thank you, Jennifer and Pippa. And I think you might have other staff or colleagues with you. So I'm going to let you introduce them, because I don't see them on my screen and I don't know who they are. So if I can hand it to probably Jennifer, I guess.
Yeah.
Nice to see you.
Yeah, thank you so much, Erwin. That's very kind. And yes,
I-
it depends on the issues, actually. Sometimes Pippa's the kite or Sam's the kite and I'm the string. So I'm very fortunate to work with two incredible deputy representatives, Pippa Rocliffe and Samantha Cocker, and an amazing team here at the RCY. So thank you very much, Erwin, and thank you for your mentorship since I joined in this role as well. Lovely to be here with you folks. I'm going to begin to share my screen in a moment, but just very briefly, if you don't know much about the RCY, we are an independent officer of the Office of the Legislative Assembly here. And we have three statutory functions. We have individual advocacy, we have systemic advocacy, and we have reviews and investigations of critical injuries and deaths that children experience. And let's just get it going here. And when we have we have about 75 staff. And when you have the opportunity and the privilege of walking alongside young people in their journey in the system, taking a look at when the system is failing young people, and being able to take a look at the patterns through our systemic advocacy, it means you learn some things and you can't turn away from it. So we're going to share with you a journey that we've been on that led to the report that we released in July, mid-July, and Erwin was there not only as a member of the Circle of Advisors, but also as a witness. And we want to hopefully share this with you because I know that you are going through in your own journey in the province of Ontario. So I suspect that many of the things that we share will be things that will be very familiar to you as well. Just before I get going, Pippa, did you want to speak in? Anything you wanted to share before we begin?
I'm good. Thank you, Jennifer. I'm just
Thank
happy
you.
being a string today. I love
Okay.
that. I just love that image. I'm just sitting with it.
Yeah, I love it too. Thank you. Okay, so our gratitude to you for showing up, being open to this peer-to-peer knowledge exchange, and in the spirit of reciprocity, so also look forward to hearing your feedback and your comments. We don't have much time, so this will be kind of a brief summary of our work. Happy to go deeper if you would like to pursue it further, and also you just really encourage you to take a look at the reports. There's actually 3 in total: a summary report of Don't Look Away, the longer version of Don't Look Away with its appendices that are online, and a companion report on workforce called No Time to Wait. So also please take care of yourself. We're not going to be going into a lot of the details of the Sacred Story investigation, the childhood death investigation that we did, but nonetheless, as we're talking about the things that that were surfaced through this and the systemic issues, it could trigger feelings. So if you need to step away, if you need to, put your camera off, please take care of yourself going through this, because this is hard work that we're all doing. So let's start here. We've been here before. We certainly have in British Columbia. I'm sure you have in Ontario as well. When we began the work, and I'll talk about that in a moment, we did a review actually of the last 50 years. We've been in existence for about 18, and we looked at our work, we looked at the coroner's work, the ombudsperson's work, the Auditor General has done work in this area, the Indigenous leadership has done work in this area. We've had so many reports that have been done by the entities, these public bodies. And then we've also had inquiries, the Gove inquiry and the Hughes review. So we have been here before wrestling with tragedy and wondering what's going to be different. And every time there's like, you know, good work done, there's commitments made, and then before you long, the status quo, which is very resilient, snaps us back. So we knew what we were up against. And so we asked ourselves, what are we going to do differently this time? So there's a few things that I think is important to share with you from a process point of view before we get into content, because process does matter when we're doing this kind of work. The first thing we did is we engaged cultural advisors. So in British Columbia, we have 204 First Nations, which is a staggering number. The little boy that died was a First Nations child living on reserve with family. And we have a significant overrepresentation of the child welfare system in the lives of Indigenous children and families. So we knew we needed to be very attentive. As a product of a colonial system, we have, you know, we report to the Legislative Assembly, we have a statute that's pretty colonial. So we knew we had to start differently. So we engaged 3 amazing cultural advisors, and they guide us every step of the way. We also approach this from the point of view of Indigenous research methodologies. Even though we are talking about all children in the province, we knew that there was a tremendous amount to gain from thinking about doing this work and our own inquiry differently. So one of the things that arose through that and through the cultural advisors were some sacred teachings. So I share that with you. This is available on our website. You can download this, which is a card. You can have sacred teachings on one side and commitments on the other. And it held us to account, because when you're doing an investigation on a child death, you can cause harm. You can share things about a family that are of their very worst days. You can create and add to stigma, discrimination, and racism, depending on how you tell the story. You can cause harm to living siblings and family members. So we had to ground ourselves in ceremony and sacred teachings every step of the way and ask ourselves, how are we going to show up differently? If we expect a system to change, we're part of the system, so we have to change too. The other thing we did was I reached out right away when, and just to give some context, a little boy we have given him the name Colby. He passed away, and it was not, we knew about it, but there was a coroner's review that was going on. They didn't do an inquest, but they were doing their review. There were criminal investigation, etc. So we can't do very much statutorily. But when the criminal investigation came to public awareness and there was a sentencing hearing, the reality of what this little boy experienced, the torture and the harms that he and his little sister experienced, was absolutely staggering. So people were gutted by the information that was shared, as were we. We didn't see that in the review that we had done there. A lot of it had not come to light yet. So when I went to, we have a First Nations Leadership Council here that's comprised of the Union of BC Indian Chiefs, the BC Assembly of First Nations, and the First Nations Summit. They work together, and we went to them to say, what can we do here? And they were so deeply impacted by what they had learned. They said, please don't just do an investigation. You have to take a look at why is it that the system is continuing to create these harms for all of our children. So we committed to doing a systemic review as well as an investigation, to use the investigation to illuminate the systemic issues that we felt could be changed. And we also knew that we couldn't do it alone. So the other thing that we did differently, we braided together the sacred story investigation, the systemic review, and then engagement. So we consulted with just shy of 2,000 people, sometimes for 3, 4, 5 hours. and multiple times as we journeyed through. And the first part was, let's understand the system as it is constructed right now. And then we went back, validated our learnings, and then said, so where do we go from here? So this is the result. We were the scribe and the listener that illuminated the kinds of things that need to be addressed. So that gives you some context, because process matters. How we do these things matter. So let's just introduce you to our little guy, because we don't want him to be known by the most horrible things that happened to him. So Colby was a little boy who everybody described by his smile, his generous spirit, and his kindness. He was a little boy that experienced, that was born with some very severe health issues. And yet he just really found the joy in life, and he believed that things would be better for him and his family. He was a loving brother. He loved school. He loved soccer. He tried really hard to participate just like every other kiddo, even though he was frequently in hospital. And he brought joy to people in his life. The other thing that's important to say here is that his family tried really hard to care for him. So this story is about him and his family and his community, because all of this is the context within which we need to remember this little boy. So his mom tried really hard, but she was struggling with intergenerational violence, substance use, mental health. And because of the unaddressed violence and the rape that she experienced as a child that no one would talk about, the violence that she experienced at the hands of various partners that no one would address, she struggled as a mom. She also brought such joy and humor and laughter and kindness as well. So there's always light and shadow in any family. And the extended family tried really hard to too, but they were often thwarted either by their own community or by the government intervention. So important to remember that. When we took a look at their story, their journey through our investigation, we found more than 40 missed opportunities just in the area of supporting his family with his complex healthcare needs. So there were so many missed opportunities, things that would have just maybe patched a crack here or changed the trajectory. So we believe that a different response could have changed the course of things. And that's what draws us into thinking about the systemic issues. So here's where we came to, and I think this is important. Colby's death was entirely preventable. Yes, he had significant healthcare needs and there were always risks, but he died at the hands of extended family caregivers that were approved by his nation and the ministry without any prior contact checks, without any criminal record checks, without any assessment as to the capacity of this family to cope. And they left him there with his sister, not visiting for 7 months, never checking. So his death was entirely preventable. And there were lots and lots of warning signs. He stopped going to school. He stopped getting his medical appointments and medical needs met. Any one of those should have triggered a response. And what we've said is that without appropriate action, future deaths are entirely predictable. The way in which we have constructed the systems that we have will create more Colbys. So one of the things we sometimes get criticized for is like, oh, well, that's just a horrible situation. Of course, our heart breaks, but it's just an outlier. That's not what really happens out there. So we thought, okay, we have to cut that kind of critique off. So we did in-depth reviews, comprehensive reviews, sort of mini investigations into 10 other families. 8 families are represented in the report. 14 children are represented. And in every one of those, we saw the same kinds of patterns. Some of these children have died. Some have life-altering injuries. And some, thankfully, with intervention, a couple are doing better now. But all of their stories were very similar. So we knew that Colby wasn't alone. In our office, we review 6,500 injuries and deaths of children in government care receiving reviewable services every year. Half of those meet our threshold or the mandate for what's called critical or life-altering injuries. And that gives us a lot of data. And then our advocates support 1,700 young people and are dealing with multiple issues. So when you have that kind of data, you start to see patterns. So, and I'm mindful of what's going on in your province, and our Colby is that many children, but Nevaeh, I think is that could be the lightning rod moment where people go, what the heck is happening? And I noted this quote, and I hope you hold the premier accountable when he says, we've got to make sure it never happens again. And if we have to take a wider look at it, we need to do. Yes, you need to take a wider look at it, because as you'll see from the insights that we have gained, this is not a ministry or a Children's Aid Society issue. This is an all-in issue. So key systemic concerns, and I just want to pause for a moment and lift my hands up to Erwin, who is a member of our circle of advisors. And we're incredibly grateful to you, Erwin, and to colleagues that we brought from across the country, the beautiful Dr. Cindy Blackstock, and Nico Trockney, Peter Choate, a social pediatrician, people who've worked in the anti-violence movement. We tried to bring the system into this beautiful circle of people who we know from our relationships care deeply about the well-being of children, from the frontline perspective or the direct service perspective through to having that kind of broader systemic view, and people like Erwin that hold both. So this is informed very much by what we learned through the engagement, through our analysis, through the circle of advisors. We distilled down to these key systemic issues. There are many others, but these are the ones we think are the big levers of change. So the issues we found was the pervasiveness of violence in so many children's lives. And I'll talk about each one of these in terms of the call to action, but we saw so many situations, and we see it over and over and over again, that violence is dismissed, especially if violence is being witnessed by a child. It's like, oh, it's not quite the same thing as if they got hit. Or situations in which the protective parent, the parent who is deemed to be responsible for protection, is given an impossible task of ensuring that the abuser has not got access to the children, and they're expected to enforce protection orders and whatnot. So the pervasiveness of violence is also at the family and community level, where we saw situations in which, for example, RCMP said, oh, that's just what that community does, or that's just what that family's like, so we won't intervene, or it's just they got to figure it out. Or within a community, not attending to it, even though they know it's the undercurrent. So the pervasiveness and the silence around violence was a key systemic issue, big lever for change. The other thing we saw is, for many of their families, it was only when things got horribly bad that anybody intervened. And then you were in a situation where you were trying to correct a major gap, major challenges within the family, rather than working upstream and seeing in the early years or providing early help that could patch over the smaller cracks and that helped the family find their own resilience. We also saw really disrespectful practice directed towards families that were struggling, those with complex needs like Colby's family did. So, okay. The other thing we found I don't know what it's like in Ontario, but if you take a look at the total number of children for whom there's protective concerns, it's about 10,500 in an annual basis. Previously, most of those children who came into care would be in foster care or group care. What we're seeing, though, is that the number of children in foster care is going down precipitously. What's happening, though, is the number of children placed in family caregiving arrangements or out of care arrangements, kith and kin care, is going up. So we have the same number of children that are struggling and needing supports, but we're relying on family caregivers. And although we've made progress in British Columbia, where there is harmonization of the basic care rates for foster caregivers and family caregivers, if they're registered or with the ministry, we haven't seen the respect shown for the family caregivers when they're trying to deal with very challenging circumstances. They're not getting access to many of the supports that would help them stay whole and support the kids. So we are downloading a lot of responsibility of family caregivers without recognizing that's a responsibility that we need to invest in. The other thing we saw, and this is an age-old thing, I've been in the field for 46 years, and it's been the issue since I began: communication, collaboration, working together, breaking down the silos. We had so many situations in which people knew things and didn't say things, and terrible things happened. Colby's is a situation. Lots of people knew things and didn't talk to one another. Medical professionals tried to raise the alarms, but they weren't, that wasn't taken seriously. So we've got real problems there. The other thing that we found was confusion over accountability, and particularly for us, as there's a significant move towards a resumption of jurisdiction. So the nation's moving to resume jurisdiction under either we've got federal, provincial legislation or the federal legislation. And in this transition time, as we know, transitions are where bad things often happen because there isn't the communication or the coordination around transition. So in Colby's situation, the nation was in the process of resuming jurisdiction, and the workers thought, oh, we don't really want to tread on anybody's toes. We don't want to be accused of being racists. So they didn't address the concerns that they had. They didn't surface the concerns because they thought, oh, well, we don't want to rock the boat. So, and conversely, the nation was assuming that the ministry was doing its checks and balances that were necessary. And so we have this dreadful situation in which there was no communication and there was confusion about accountability. So no one took accountability for the decisions. So that was a key thing. And then if we go the 10,000 foot level, we actually don't know what the outcomes are for kids in our system. We don't know if this program is working or that program is working, or if this modality is appropriate or that modality. We don't know. We have no accountability framework. We have no outcomes framework, and we have lots of data being collected, but nobody knows what to do about it. And then the sixth area was about the workforce capacity. It's a strain in every area, community sector, as well as government sector. But we focused a lot on the Ministry of Children and Family Development because we thought none of our changes are going to happen if they don't have the capacity. And in many of their offices, they're at less than 50% capacity. They might only have one delegated worker. That worker is not able to fulfill their responsibilities, and we've got tremendous exit rate out of government programs and services right now. So we had to address that. So those were the concerns, and I'm curious as to whether they resonate for you and your knowledge of the system. Obviously, there are other things like residential care is hugely problematic here, but that didn't get surfaced through Colby's story, and we were really accountable to him and his legacy and what we needed to learn from him. So we're addressing some of those other gaps elsewhere, but those is what showed up for this family story and our other family stories. So what are we going to do? So there were calls to action. We call them collective responsibilities. The overarching one is a mindset shift to think about child well-being. If we think about the well-being, the opportunity for a child to thrive, then you begin to expand the circle around those children. You begin to think about the role of public health nurses, for example, or we have nurse practitioners here and nursing, nurse family partnerships. So they become part of the opportunity to make a difference in the life of a child. Early childhood educators and childcare providers, kindergarten teachers. I think kindergarten teachers are the best things because they see children often who might not have been seen before, and they can teach us a tremendous amount about how we might be able to lean in and support that child or the family. So we bring in educators, we bring in medical professionals and healthcare professionals. We begin to bring in, community support systems. So if we begin to think about well-being, it expands our mindset about what we're trying to do for kids rather than wait and just focus on the safety. So that's our big overarching call. Then we started to go into, okay, what are some of those areas? If there's a pervasiveness of violence, we have to address violence. We have to see it, we have to name it, we have to act on it, and we have to support and family and community healing. We have situations where there's one-on-one, maybe they get some support through victim services, but there's no family supports and there's no community healing by and large. So, and these quotes, by the way, are from our circle of advisors or from the engagement sessions we did. And this was a big game changer for us, that notion of children who are exposed to violence or experiencing violence. So if children who are witnessing, we've often kind of said, well, that's not quite as serious as if a child gets hit. But it is. It affects their sense of safety in the world. It affects their physiology and their sense of emotional well-being. So we have to take violence very seriously. So that was our first call to action: address the violence. And this other one was, and this was from the Circle of Advisors, we asked Child Protection to step into spaces where society has essentially failed to provide prevention and support services. So we are downstream. We need to go upstream, address issues early. And I'm going to try and channel you where when it's like, families get what they need, children get what they need when they need it. And that includes housing, food and income security, mental health and substance use, the basics. Like for Colby, he had medical needs. He needed specialized formula. He didn't get the family had no capacity because of the lack of income to ensure that he had the formula that he needed when he came home from the hospital. They didn't have the means to get the medical supplies that he needed for his ostomy, like that's when they need it then. They don't need it 3 months from now when somebody has processed some sort of form. They need it then. They need it when they need it and for however long they need it. So really beginning to think upstream, early help in the early years particularly. So that was our second call to action. The third really related to the fact that with the growth of the use of kinship carers, what we often didn't appreciate or understand is that many of those kinship carers, they're often grieving their grandparents primarily, and they're often grieving what's happened to their own children as they're bringing in their grandchildren. And they've often had history of an involvement, and it's not been good. So they're terrified of asking for help. So instead of creating this situation in which you have to ask for help, we should be saying, you and the child we want you to be successful. So let's make sure that you get access to the supports you need without the stigma. Just yesterday, I heard of an auntie, she's taken in 2 of the children, and the ministry said, oh, well, we'll give you $100 a month to take care of these kids. It's like, are you kidding me? That's ridiculous. So clearly we haven't got this down into the day-to-day practice, but support the kinship care providers is really important. The other thing, call to action, was around communication and collaboration. We have a situation here. I don't know if you find it there, but it's like people don't talk to each other because they say, oh, well, we can't share information. It would be against the law. And in fact, most of the time it's not. We actually have significant provisions, but there's kind of this mythology around not sharing information, and we don't have good case management practices that brings people in with the multiple professionals that are often involved in families' lives. So we have to address the well-being differently. We have to have a bigger tent, and we have to be working across our differences into supporting. And then the next one was around, how do you hold not just people, but a whole system accountable? We often see in British Columbia where the workers get blamed for the challenges or the deaths of a child. It's like, well, that worker didn't do that. And, but really, what's the system that's enabling that worker to do their best work or not? So how do you hold a system accountable? Understand what's helping, what's not, and making informed decisions and investments. And in fact, in our No Time to Wait workforce report, we actually made a recommendation that when a tragedy happens, that the and it sounds strange, but we just felt it was really important that the minister and government cannot blame the worker. They have to address the systemic issues and stop blaming workers. Just a simple thing, but very profound, because workers are terrified and it's a culture of fear. And therefore, when you've got a culture of fear, you're not operating from your best self. You know, you're not bringing in your creativity, your possibilities, your crazy ideas that might be the thing that could break things open in a good way. So that's where we've identified our key areas for action. There are a total of 66 recommendations altogether. When we did the release that Erwin was with us at, the minister stood with us at the release and accepted on behalf of government all of the recommendations, short, medium, and long term. There are some that are very short. It's like give workers more of a toolkit so that they can, you know, deal with the vulnerabilities that are creating neglect issues right away, you know, like simple things. But then there are things that will take, 10 years to do because we've asked for a fundamental shift. And we've also said it's an all-in thing. The ministry can't do it alone, shouldn't do it alone. We have to have, public safety and solicitor general and mental health and addictions and health and citizen services and Indigenous reconciliation and the health authorities. Like it's an all-in effort, including our community sector. So now I will just speak to this. I don't know how much of an issue it is in Ontario, different landscape for sure. But one of the things that the matriarch said is, look, there's a lot that's being put into jurisdiction is it's going to make everything better. It's not on its own. It has to be undertaken with the healing, with the family support, with the appropriate resourcing. So we've said, be careful, be cautious, take the time you need, be in relationship, and make sure that it's not just looked at as, a protection issue, but, mental health needs to be involved and health needs to be involved in income security. So that's a piece on jurisdiction that may or may not be relevant to where things are going in Ontario. So this is a North Star. But if we don't know where we're trying to get to, then we could be taking multiple different paths. So we wanted to set the North Star, the big ideas. We have to change mindsets. It won't be good enough if we just tinker around the edges. So I'll just share with you a couple of calls and urgings, and then we can stop for questions. What we've said to folks is that this is all in. We're going around talking to anybody who will have, I just came from the Child and Youth Advocacy Centers, and we have an opportunity and responsibility right now to ensure that children that are living today and those yet born don't have to survive their childhoods or spend their lives recovering from their childhoods. Too often we hear and see those patterns emerging over and over again. That means we failed way back in a childhood. So, and this, I think, is your quote, actually, Erwin, that we've often focused on the superficial changes rather than substantial transformation, and that it's going to be uncomfortable. We're going to have some really hard conversations, and we can't get where we're going without being uncomfortable and discomforted. Because, whether that's because we have our favorite program, but it's not serving children very well anymore, based on what we know about child development. So we're going to have to give up some things, or having those difficult conversations about violence in community and what, like people turning away from it or somehow normalizing it. So it's going to be uncomfortable, but we can't just tinker on the edges anymore. And then I'll leave you with this. This is from Jody Wilson-Raybould. And I loved how she talked about real substantive change. She was talking in the context of reconciliation, but I think it's applicable to all of us. It's only going to happen if we are very clear about the actions we're going to take to do things differently and make things different. And that is, as Erwin has said, it's going to take courage. But the beauty of thinking about it this way is that it means that we can't be, bystanders to the process. We have to be invested in the process going forward. And I had the joy and the pleasure many, many years ago of being part of the deinstitutionalization movement when we had 3 institutions here with thousands of people in them. And that was a movement that was very, very thoughtfully and emergently designed. And it resulted in the closure of these 3 institutions for people with developmental disabilities. And it's far from perfect, but it can happen. Fundamental transformation can happen, but it is going to take that kind of grassroots movement and us not turning away from it or somehow investing in government. We're coming up to an election in a month's time. I don't know. It's neck and neck between conservatives and New Democrats. They're very different in their approaches to the world. So we can't be at the whim of political discourse and polarization. We have to get in there and figure out, well, what could we do? And what's the way in which we demand accountability and behavior and appropriate behavior for our kids. So as I say, there's a commitment card if you want to play with that idea. And then what we've invited people to do here, so you can apply that in your context or help us, and we can start to do some interjurisdictional work, is we're saying, look, folks, we have to keep this alive. We're very committed. We're going to be doing issue papers or issue briefs to show our homework, basically our long division on all of the work that we've done. Otherwise, we would have had an 800-page report. So all of the research that we did, all of what we learned, we're going to keep at this because I am tired of doing reports that over and over again say the same things, and we aren't changing the trajectory of the lives of children and youth. So I'll stop there, and hopefully we've got a wee bit of time for questions. Thanks, Leora. Thanks, Erwin.
So feel free to unmute and share or put up your emoticon hand if you'd like to share.
There's my hand.
Hi, Norma.
Hello. Oh my gosh. Thank you so much for this discussion today. I'm Norma Nicholson, and I managed healthcare in our largest jail in Ontario.
Okay.
And the transition and trauma that those kids go through when they come to us from the Children's Aid Society. And I see most of what should be done in our community is not done until they're incarcerated. So you're so right in terms of we need effective and skilled individuals to be working with our cultural diversity children, because a lot of Black kids, they say they just have bad behaviors, and in fact, they're either addicted or they have undiagnosed mental illness. And so I'm signing that card because I'm also an author, and I plan to touch 1,000 lives this year. If it's even to say, read this report, I've started touching lives with my book that's called End the Incarceration of Black and Minority Youth.
Oh, that's beautiful, Norma.
Jennifer, thank you.
Thank you. And, I think that's an example of that kind of, if we're interconnected and we start telling these stories, it's like these children have backstories. What if we understood what happened to them? And, and begin to say, well, what could have been done differently? We've missed those opportunities, but it's, one of the things that I love, and I know Erwin shares this, is it's incredible what young people have to teach us too. Because their generosity, they often say, I know it's not going to change my life, but I want it to change the lives of the children yet to come. So being able to understand children's stories and bring children's voices into this as well to challenge the assumptions we make about children and we see it all the time. In fact, we were talking about it last night for another report we're doing on systems failing girls, but the language that is so dismissive and derogatory, and it places the responsibility on the child or the family rather than on us as adults who should be caring and on systems that we build. So I appreciate what you're saying in a very, very challenging area of practice. Thank
Hello,
you.
Erwin.
Mhm.
Thank you.
Thanks so much. Is there anyone else that wanted to ask some questions or offer some commentary? Got about 5 minutes before we'll close out with Leora.
Hi.
Good afternoon.
Who is that?
You can't see me because I'm very busy, but my name is Advocate. You can't, but my name is Shaniqua Daly. I'm a child advocate. I have sat on the Ontario Provincial Advocate Board for Black children and youth. I have a question. So my question being, for someone who was in the child welfare system until I aged out at 18, currently now I find myself struggling with my own mental health. A lot of diagnosis and in my young adult years. Due to the provincial government cutting the advocacy board that we had in Ontario, where do we go from here in terms of advocating for other Black youth or just youth? I don't really see a lot of programs set up where we're able to mentor or even be an assistance to give our experience so we're able to help them going forward.
Yeah, thank you so much. Such an important area. I'll and happy to share with Stepping Stones. We did a report called A Parent's Duty, which I'm very proud of. Again, very much informed by young people. Two, actually, From Marginalized to Magnified, which took a look at youth and the superhighway to homelessness and the need for a housing plan. But the Parent's Duty actually spoke a lot about that. And you may want to take a look at that in conjunction with the program that arose from that called SAGE, S-A-G-E. I can't remember what it stands for, but it's basically, a reimagined post-majority service that recognizes that the impact of being in care has consequences into young adulthood and adulthood, and therefore there is a responsibility. If the state has assumed there was responsibility as a parent, it doesn't end at 18 or here in 19. And therefore there is those kinds of transitional supports up to age 27 here. So I think it's, again, we didn't deal with that in Don't Look Away because it didn't get surfaced through Colby, because Colby was 11 and his family wasn't in that place of the transitions to adulthood. But you may want to take a look at a Parent's Duty report and think about, where's the appetite to address that issue within your government, because it did have a pretty significant effect in British Columbia to expand the scope of services, which included mental health, life skills, much more transition planning up to age of majority, but subsequent to that, access to mental health supports, life skills supports, housing supplements, supports for kids to go to school, sustain their education. So a number of things there. I hope that's helpful.
Just before we move over to Kate, before we move off of Shaniqua, you also asked about spaces where you could lend your voice. Is that correct?
Correct. As I've done it before, and I've gotten a lot of help education wise. I went to school for human resources. I got help with that financially, but I felt like other areas which I struggle with, and I still struggle with, is mental health and stuff like that. And I feel like there's a lot of money put in towards education, which is great. I finished school, and I know a lot of youth I went to school with who are in care. They also, a lot of them completed school that I still keep in touch with, but you're still struggling out. That was my biggest area where I can use my voice to advocate. It also needs to be addressed.
So some of that got cut out a little bit, but from what I heard, there's some great programming that StepStones for Youth has that you could likely connect with that might be a place where you could utilize your voice. At OACS, we also have the One Vision, One Voice program, and there's some community committees that you could potentially be a part of. And then there's the Never Too Late, which also has space for folks with lived experience to sort of be a voice. And so those are just 3 things that you could connect with. So if you want to follow up with us offline, and we can send you those contacts, or we can throw it into the chat so you can do some follow up with them. Okay, sorry about that, Kate.
Hi. I'm hoping to just, I guess, put some emphasis on some points that were touched on. I can't say enough about the importance of providing that preventative support to families. Just to very briefly give my, I guess, context to why I believe this. I'm a parent who I had my daughter apprehended from the hospital at birth for I was a victim of domestic violence before I was even pregnant, and the father who was the abuser, we reconciled. We weren't given any options zero support, 0 options as to alternate ways that I could remain parenting her. She was put into foster care, and just the trauma of that extremely affected my ability to parent in the future. I wasn't provided with anything. It wasn't even acknowledged. In fact, I was told that her being taken right now was a gift so that I could work on myself and that she wouldn't remember any of this. However, though she doesn't remember the details, she absolutely is aware of the separation, and it does affect her. We were reunited a year later, but 4 years later, it is still something. She's in play therapy. My point being, we need to have in place, we can't be punishing people for circumstances that are largely out of their control, where they didn't perhaps they're blamed for not taking opportunities that they didn't even have. And I believe that what is often in the best interests of the child is to support the parents and help them to have the capacity to parent in a safe and nurturing way. And I believe that element is often overlooked when we're focusing solely on the protection element at the crisis point, and not looking at what we do that either actually causes people to end in this in a systemic and structural way. So I just hope that can, I guess, be part of the emphasis. And I very much appreciate all of this conversation, and know that anecdotally, this doesn't represent all cases, but it definitely seems to be an overarching theme.
Mm-hmm. Thank you, Kate. And yeah, I just can't even imagine going through that as a mom and who's trying to figure out how to do the best you can for your child. So I do really appreciate you speaking in. And I couldn't agree with you more. And, Pippa's on, and it's one of those things that we've talked a lot about, of the necessity of reframing the work. Again, well-being, what we know makes a difference in the child's life, is to be able to be with their family. And some families aren't able, some parents may not be able to care, but there is always family. And the other part that's so important related to that is that sense of agency. So what you're talking about is like, okay, what would it have looked like if there was a different process? Like somebody's worried, then what would the family planning, what could be the options that could be presented? What are the kinds of ways in which you could be actively involved? And so you're absolutely right. That was the thing we see over and over and over again, is the lack of timely family supports in the early years. And that early help that could change the trajectory, because otherwise you're constantly trying to recover from those missed opportunities. So I couldn't agree with you more. And we'll be doing some issue briefs pertaining to keeping families safely together, that hopefully will be helpful, as well as we continue to reimagine the ways to support families so that children don't come into care in the first place. So much in the chat here. I don't know whether it's helpful. I could, take a look at this chat and then just send some notes back to you afterwards, because I know we're out of time.
If that's just okay, I do know that we are at the 2 o'clock mark, and Leora wanted to just close us out with some interesting new information from StepStones.
Hi, everyone. So just to quickly introduce myself, I am Leora Sobel, and I am the Chief Operating Officer at StepStones for Youth. Let me just quickly start by thanking all of you, not just for joining us today, but also for your investment in the health and safety of our children. Erwin, I want to thank you for all your hard work, insight, and collaborations. Pippa and Alana, thank you so much for sharing your work with us. I think we can all agree that we're inspired by the work you've done, the knowledge you have shared, and the changes you are making. But it is also clear to us that we need to work towards our North Star in Ontario. And at StepStones, this is a priority for us. So we will be convening thought leaders and leading a think tank towards creating our Ontario North Star. We're looking at how to create the conditions to ensure that all families and children get what they need when they need it. And this will be happening next year in April. We'll also be looking to engage the bigger community to provide input into this and advise us on what is happening and moving forward. So I've put in the chat, please reach out to us at change at stepstonesforyouth.com. We will share information of what's going on. We will convene together, and we really hope to participate with all of you in making these changes here in Ontario as well. So thank you all for being here today.